Okay, this is from the book Dr. John McDougall, Who Fought for You by me, Pete Rogers. We're on the chapter about autoimmune disease, and this is what Dr. McDougall wrote. He said, upon switching to the McDougall diet, patients will usually start noticing a benefit in about 4 to 7 days. It takes that long for food to get out of the colon. So yeah, once the food goes down in your colon, it sort of sits there, and the gut will pull water from it very often. If you got fiber, that helps keep water into the stool. But the point of it is, if you're having allergic reactions, leaky gut-related reactions to the food, it's going to take about at least 4 days before it's all out of your system, maybe 7 days. Okay. Then you should expect to improve. The acuity of the joint symptoms should decrease, and the existing fibrosis, means scarred collagen tissue in the joints, that's not going to go away, but it should not progress anymore. Within 4 to 6 months, patients with rheumatoid arthritis, lupus, and psoriasis are often cured. So that's a key point. If you tried it for 4 to 6 months, you're either going to respond or you're not. Okay, if you haven't seen improvement significantly by 4 months, then you're not going to improve with the McDougall diet alone. You might need some special form of a more restrictive elimination diet. And Dr. McDougall has an elimination diet. You just go to his website or his YouTube channel and you'll see more detailed information on these subjects. Here you can see it in his Dr. McDougall newsletter, June 2006. And now he's writing here about gout being on the rise. Okay, so he says that the main cause of elevated blood uric acid and gout is eating animal foods like meat, poultry, fish, seafood. These are the most important sources of purines. The purines lead to elevated blood uric acid. Vegetable sources of purines do not contribute to the risk of having an attack of gout. Alcohol does increase the risk of an episode from gout. Also, high fructose corn syrup will as well, because that's going to lead to increased blood uric acid. When people lose weight, they can get a transient increase in blood uric acid, leading to an episode of gout. This happens because the body is dissolving body fat. The risk of these attacks is very small. One can make a definitive diagnosis of gout by extracting fluid from a painful joint and putting it under a microscope to show the uric acid crystals. Now, here is a list of some autoimmune diseases. Autoimmune diseases, by the way, are 80% of them occur in women. They're more common in women. Women have a more sort of hyperactive immune system, which might protect them from colds and some things like that, but it also increases the risk of autoimmune disease. Okay, alopecia, hair loss. Okay, so when somebody's losing hair, that could be due to alopecia. That's what the Mastering Diabetes guy had, Cyrus Kumbada, and he also had, he lost his eyelids, the hair on top of his head, and he also got type diabetes, type 1 or type 1.5. Okay, the next one they mention here is ankylosing spondylitis, and that's associated with an autoantibody, HLA-B27. Every medical student memorizes that, and then when they're done with their training, they try to forget it, but they can't. It's just so memorable. Asthma can be an autoimmune disease. Asthma can also be more common if you're eating a high sodium diet. That tends to make people a little more risk for asthmatic. My brother was that. My brother was this awesome athlete, state champion, freestyle Greco in high school. Then in college, everybody thought he'd be an All-American national champion. He was kind of a disappointment. He was never an All-American. And nobody knew why, but he just didn't have the energy, to compete against the Iowa guys in the third period. And it turned out that once he became a vegetarian in his, largely vegetarian, in his 40s, his endurance improved again, and then he became a world champion. My brother's a world champion athlete. Okay, celiac disease. Okay, that's, the whole gluten stuff. Crohn's disease, a lot of this stuff, it's obviously dietary. People fix their diets, they get better from these things like Crohn's. Dermatomyositis of the skins, diabetes type 1. Diabetes type 1 is especially from cow's milk. Okay. Eczema can be autoimmune disease. Hyperparathyroidism is now thought to be an autoimmune disease related to overstimulation of the parathyroid glands, trying to compensate for excessive dietary intake of phosphates from animal foods. A chronically overstimulated parathyroid can become autonomous, and that'll lead to hyperparathyroidism. Some inflammatory arthritides, interstitial cystitis of the urinary bladder. You can see the Dr. McDougall newsletter from May 2014 on that topic. Juvenile rheumatoid arthritis, JRA. That might have been what what's his name, Jordan Peterson's daughter had. I'm not sure, but a lot of times bad arthritis in a young person is juvenile rheumatoid arthritis, JRA, but she claims to have cured it with a carnivore diet. I don't believe that. It doesn't make sense to me. Lupus was very rare in Africa when they ate plant-based diets. Lupus is relatively common now in Black American women who eat very little plant foods. Same thing with rheumatoid arthritis. You couldn't find a single case in all of Africa before 1957. And the more animal foods blacks eat, the more rheumatoid arthritis they get. Multiple sclerosis, Roy Swank, MD, has the best outcomes in the world for treating MS. He went to China like around 1960, and he said he couldn't find a single person with MS back when they used to eat the vast majority of their calories from white rice. Okay, there's a Dr. Mcdougall newsletter about MS from July 2012 and about how lousy the drugs are, and they're real expensive. Myasthenia gravis, sort of a weakness. We won't get into that right now. Nonspecific arthritis. Parkinson's disease, he thinks, is possibly autoimmune. There's a lot of different theories on causation of Parkinson's disease. I actually think it's multiple different diseases. Let's see. That's Dr. Mcdougall's newsletter on Parkinson's and other diseases. Pernicious anemia, autoimmune disease, polymyositis, psoriasis, skin lesions, typically improves with the vegan diet. Kempner had reported a lot of his psoriasis patients getting better. Psoriatic arthritis, Reiter's syndrome, relapsing polychondritis. I think Jeff Nelson's wife had that. So anyways, there's a whole bunch of diseases that are associated with autoimmune. And you can also just have irritable gut from something similar, irritable bowel syndrome. So the bottom line is all this stuff became way more common as populations ate more of a high-fat diet, more of an animal food diet, more oils. Okay, and so this will be it for introduction to the topic, part 1. And part 2, we'll start going into a little more complexity. Then we'll go through the mechanisms and all that and the different things that can cause autoimmune disease besides leaky gut. There's other things that can do it as well. Hope that's helpful.